All right, this is my Chapter 5 lab. Our subject is an 18-year-old volleyball player in high school. We're going to start with the anterior view, and we'll start down at the foot and ankle. And you can see here we've got some eversion of both feet, and also some pronation of the feet or flat feet. It's not terrible, but it is there. Moving up to the knees, you can see a slight genu valgus stress or knock knee. Moving up to the hip, the pelvis appears to be level and in the same transverse plane. It's not higher or lower on one side or the other. Looking at the shoulders, they appear to be level. They're not elevated or rounded excessively. And the head does appear to slightly be tilted to the right, but it's not excessive with motion. Going to the lateral view, the foot again, you can see the eversion, and so that 90-degree angle that we want to see in relationship to the lower leg is not really present because of that eversion. Moving up to the knee, the subject doesn't show to have any hyperflexion or hyperextension. And when we look at the pelvis, you can see some anterior pelvic tilt, so you get a little more of a lordotic curve there. The subject does show a normal kyphotic curve, and the shoulders aren't excessively rounded. The head is in a neutral position, okay, and it's not excessively extended out. Moving to the posterior view, the feet again, you can see the eversion with the feet, and again you can see that pronation or flat feet going on there. There is some genu valgum present or knock knee. The pelvis again appears to be level when going over both posterior iliac spines, and they appear to be in the same transverse plane. The shoulder is level, and it's not excessively protracted. And again, you can see that slight tilt to the right side with the head. When looking at the patient, it appears that the patient does have a pronation distortion syndrome. You can go ahead and turn back around. Pronation distortion syndrome is characterized by excessive foot pronation or flat feet, knee flexion, internal rotation, and genu valgus. So you can see some knock knee, the pronation, and the eversion going on there. The tighten muscles would include the peroneals, the gastrocnemius, and the soleus, the IT band, the hamstrings, the adductors, and the psoas. The functionally weak muscles would include the posterior tibialis, the anterior tibialis, the vastus medialis, the gluteus medius and maximus, and the external rotators of the hip. If the joint dysfunctions could include the first metatarsal phalangeal joint, the subtalar joint, the talocrural joint, the sacroiliac joint, and the lumbar faucets. And potential injuries that could occur because of this distortion could be plantar fasciitis, posterior tibialis tendonitis or shin splints, patellar tendonitis, and low back pain. Just a few basic things that we may do in a corrective exercise program is we would need to work on those short or tighten muscles. So stretching, some soft tissue release techniques to the gastroc and the soleus. Also to the peroneals, the adductors. We could use some soft tissue or even foam rolling exercises for the IT band. And we'd also need to loosen up that hip flexor, stretch that hip flexor out. The muscles that are weak that would need to be strengthened would include the anterior tibialis and the posterior tibialis, the vastus medialis, so the quadriceps, our hip extensors, the gluteus maximus and medius, and also the hip external rotators. We also, would want to work on increasing ankle dorsiflexion and ankle inversion motion at the ankle to reduce the risk of injury with our subject. And that's about it.